And we have Komalji, who's a homeopathic consultant over there, will be joining us shortly. And Komalji, are you there?
Yes, Anjali, can you hear me?
Okay, welcome to the show.
Yeah, thank you so much.
Yes, so as I was just saying, this is California Homeopathic Clinic, and we are in San Jose. The address is 1121 East Santa Clara Street in San Jose, and the website is cahomeopathy.com, and the number to reach us is 408-287-9300. And California Homeopathic Clinic has been serving the Bay Area from last 14 years, and we have helped patients with practically all possible conditions, and they've been really benefited a lot with homeopathy, and without any side effects and all that. Even though it's from chronic to the problems which have just started, from kids to elderly people, all sets of age groups or any kind of a problem, homeopathy does show very, very good results. So we will be opening the lines in few minutes, and as in all our talk shows, we always pick up a topic which we notice that it's been the problem is getting more common, or we have more and more patients coming in with that problem. So we always pick up that topic and share more information so that listeners can figure out hey, what's happening, and before it gets chronic, they try to they can come and seek the homeopathic treatment. And as I had just mentioned, we have Komalji from California Homeopathic Clinic, who will be sharing all that information with us, which is purely on educational basis. She won't treat, diagnose, or cure any patient. So all the information is on educational basis. And Komalji has done her bachelor's in homeopathy, and she has her MD in pediatricians, and she's doing master's in healthcare admin also. And recently, congratulations, Komalji. Recently, she has been honored by Golden Key Scholars Society for her amazing work. So we congratulate you.
Thank you so much, Anjali ji.
Yes. Yeah. So we do have a caller already. Let's just take that caller.
Yeah, sure.
Let's start with our topic. Yeah, let's take the caller. Hello, caller. You're on air. Please go ahead with your question.
Yeah. I wanted to know if you can give me some home remedy for hypothyroidism.
This is a homeopathic show now, so whatever we will be talking about would be based on homeopathy.
Yes.
So you can, if you wanted to talk to Divyaji, you can call in at her number. And now this is homeopathy we are talking about for next half an hour.
So this is not a correct phone number?
Yeah. Okay.
I need to call back. Okay, thank you.
Okay, thank you. So as I was talking earlier, we will be talking about uterine fibroids today, which is a common, very, very common problem which we have started seeing. In fact, if we look at the statistics, it shows us that every 3 women out of 4 has this problem, which they know or somehow don't know, and then by the time they come to know, or they go and seek the doctor, the problem has already become chronic. So today Komalji would be discussing about what are the different kinds, what are the symptoms, and how homeopathy can help this particular issue. So Komalji, can you please give some information to the listeners? What is basically the uterine fibroids?
Yeah, sure, Anjali ji. So today we are talking about the uterine fibroids. So first of all, I want to say the listeners that this is not a cancerous tumors. Most of people think that okay, they got the tumor, so it's gonna be cancerous. So no, it's a benign tumor most of the time, and it happens in the childbearing age. So here, childbearing age, we mean that from the puberty to the menopause. So puberty starts from like 12-13 age till like 55 or 50 years of age. It happens in between that only. Medically, we also called as leiomyomas or even myomas. So normally they do not convert into cancer. This is what the main point I want to say to the listeners. Okay. They can be single in number, they can be multiple also. So usually in the initial stage, as you were also saying, people are asymptomatic. We have already seen in the clinic. So people always bring their routine checkups and then they got to know, oh, they have the fibroids, but they don't get the symptoms in the initial stage. And then when they get all the symptoms like their menstrual cycle disbalances and all the other pains and all that, then the position and their stage has already increased. So yes.
So listeners, again, this is California Homeopathy Clinic, and we are talking about uterine fibroids today and how homeopathy can help us with that. And we will be opening our studio lines now. If you have any questions related to this problem or any other problem which you think you would want to try homeopathy, please give us a call back here at 408-912-5565. Again, the number to reach us now is 408-912-5565. So, Komalji, continuing with the topic, what are different kinds of this particular fibroid,
Yeah, so before going towards different kinds, first of all, we need to know how it starts. So how it starts is there is some imbalances starts in the wall of the uterus. So there are the smooth muscle cells where there starts the imbalances, and then they start multiply in a bizarre condition. So bizarre, we say, like in like heavy multiplication. So it can go in any way. It can go inside the uterus, it can go outside the uterus, it can remain inside the uterus wall, or it can become hang also, right? So according to that, we have considered the types of the uterus. So if it is inside the uterus, we call as submucosal. If it is outside,
we have few callers already started calling in, so let's take calls at the same time, and then we will continue with the topic. Yeah. So let's take our caller. Hello, caller, you're on air. Please go ahead with your question.
Hi, Komalji. I have a quick question. Do you think homeopathy can treat a condition called trigeminal neuralgia?
Oh yes, yes, it can.
Okay. Do you Can you treat that in your clinic here?
Yes, we do. We have few patients of that.
Okay. Then I'll touch base with you offline.
Sure. You can call us after the
show. The number to reach us is 408-287-9300.
Okay, thank you very much.
And we are open on the weekends also, as well as weekdays. So, based on your, we do give weekend appointments also. Again, the number to reach us is 408-287-9300. And let's take our next caller. Hello, caller. You're on air.
Yes, I have a question about hypothyroidism, and I want to know if she has some suggestion as like home remedy or something like that.
See, right now we are talking about homeopathy, and yes, homeopathy has amazing results with thyroids, and either it's hypo or hyper. Either ways, we have lots and lots of patients who've been. So let's ask Komalji about this. Komalji.
Yeah. So yes, of course, we have very good results for the thyroidism, and for the thyroid, we not only consider the thyroid if it is hypo or hyper. We have to consider the whole patient, the whole reports of the patient. Right. So we have to look, the whole one. So we cannot give you the one medicine for thyroid. It won't be like good for you. So I would recommend, if you are taking a medicine, please talk to us after the show, and then we can see your case, and accordingly we can give you the medicine.
Yeah, or you can send us an email also, in which you can just mention, for how long you've been having this and what are your TSH and all those levels, and then for how long have you been taking the medicine, and what's the, how much medicine are you taking. So these few things, if you can mention, then we can always send a symptoms profile, which is like an intense questionnaire from 6 to 7 pages, which you guys fill and then send it back to us, and based on that, we can make an appointment, or we can suggest some medication, right, Komalji?
Yeah.
So again, the number to reach us is 408-287-9300, or you can send us an email at cahomeopathy.com.
All right, thank you.
Yeah, let's take our next caller. Hello, caller. Please go ahead with your question.
Doctor, homeopathic में diabetic में क्या medicine हो सकती है?
Sorry, I'm not able to get you.
Komalji, he's asking कि homeopathy में diabetes का कैसे help करती है homeopathy diabetes के लिए?
Okay, so in the diabetes we have very good medicine, but we cannot, say you, okay, we're gonna cure it, because we have to see from how long you're having diabetes and what is the extent of the diabetes, what is the amount of it. So but we have very good medicines, and we can assure that you will stop your allopathic medicines.
Yeah. So yes, again coming to the diabetes also, we have such amazing results, and we've noticed that the levels have been stabilized, and there are so many patients they don't have to. With diabetes, we know that the medicine keeps on increasing, and ultimately you reach a level where you have to start taking insulin and all that, right?
Yeah. Then so you don't need to.
Yeah, you don't need to. We have really good results. So you can always talk to Komalji after the show in more details, or you can send us an email again at cure@cahomeopathy.com, or you can go to our website, which is cahomeopathy.com, and send us an email from there. Or you can call in at 408-287-9300.
Oh, thank you
Thank
so
you.
much.
Okay.
Thank
So,
you.
what is homeopathic medicine? Can I stop my allopathic medicines, or they will go sideways?
We don't recommend that, and especially in the beginning, we never recommend that. That you always have to consult your regular doctor. But again, when you see the results that the levels are going down, or whatever, then the decision would be you have to consult with your regular doctor.
In the diabetes cases, what we do is we will give you homeopathic medicines first with your allopathic medicines, and you will take it along with that, and then after some time you can taper it down, and then after getting the results, and once your levels are in the control, then you can stop the medicines.
Okay, all right.
Yeah.
Thank you for your call in. So Komalji, let's continue with our topic. We were discussing. You were telling us about the uterine fibroids. So
yeah. So I was telling you that there are different types of fibroids according to the location. So I was already telling you that inside uterus we call as submucosal, outside are subserosal. If it is inside the uterus wall, then we call as intramural, and if it is hanging from the uterus, so it can hang inside the uterus or outside the uterus, so we call as pedunculated. So in what our homeopathy does is it stops the multiplication of the cells. If it is pedunculated, so it will fall off. If it is subserosal or submucosal, which is increasing in the size, then it can stop the multiplication and reverse the growth of the cells.
Okay.
Right. So that way homeopathy works. So you don't need to get the surgery done.
Oh yeah. Usually, we've heard that surgery is the only option with the conventional medicine. So and then so many times people, they just get scared just by when they come to know, I have to get the surgery done.
Yeah.
So that's really good to know, Komalji, that
along with that, I want to tell listeners that when they get to know, okay, they have to get the surgery done. So you really have to consider your age, because this problem occurs only in the childbearing age. If I've seen many patients who are already in 35 years of age or 40 years of age, they get their hysterectomy done. Hysterectomy is when they remove the uterus, the whole uterus they remove. But you don't need to, right? If you wait only for like 1 or 2 years, you will get the menopause, and then your fibroid will subside itself. You don't need to get this surgery.
You don't need to do. Yeah. But see, this information not everybody knows. So so you have to know all that to make such kind of decisions. But when we have homeopathy around here, which can help you with such conditions, I think that's really, really amazing. So, Komalji, can you just let the listeners know some symptoms about how one would come to know that we are having something?
Yes, So I was coming to that only. So first we need to understand how the symptom arises. So when we are saying it is in the childbearing age, so that means it is considered that estrogen and progesterone, which are the female hormones, they are responsible for feeding this fibroid. So when they get disturbed, then you get a lot of problems like your menstrual cycle. So you will get, some people get very heavy menstrual cycle, or it can last for maybe 5 to 10 days. It can have a lot of clots in it, or maybe sometimes people see that spotting in between the menstrual cycles. So if you have these kind of problems, so this problem happens mostly in submucosal fibroids, and this often lead to infertility and miscarriages. So if you are planning to have a baby, then before that you have to get your routine checkup done, all your ultrasounds done, and see if you have any problem. If you have it, then first treat this first, and then plan for pregnancy.
Oh, okay. So this can stop them from.
Yes.
Okay.
Yes, and even if if even somebody conceive, they can have miscarriage in second or third month.
Oh.
Yeah. So next.
So listeners, again, this is California Homeopathy Clinic, and we are talking about homeopathy. And if you have any questions related to any problem, you can call in at 408-912-5565. Or the topic for today is the uterine fibroids, and we are sharing some information, some very important information on that. You can call in for that or any other problem related. Again, the number is 408-912-5565. So, any other symptoms?
Yes. So next symptom, I was telling, the patient is gonna feel pressure in their pelvic area. It depends on the size. If the fibroid size has increased a lot, then it's gonna give pressure on your urinary bladder and on your pelvic area. So if it will be pressure in your pelvic area, then the woman always says that whenever I stand up, then I feel so much pain and heaviness in my pelvic area. And when it will be a pressure on your urinary bladder, then you will have urine incontinence. That means she will feel like the bladder is full again and again, and when she goes for the urination, she just farts a little bit. So she has to go again and again, and because of that, she gets recurrent UTIs. UTIs are urinary tract infections.
Yeah, that's again a very common problem.
Exactly. Right? Yeah. So then the woman thinks that, oh, I don't use public toilets. I maintain the hygiene. Why am I getting this UTIs again and again? And for this, she takes a lot of antibiotics. Right? And because taking these antibiotics, taking a lot of antibiotics, it again produces the fibroids. People are not aware of that. When you're taking a lot of antibiotics, it is a common cause for producing a fibroid.
Oh, so that means taking lots of antibiotics is one of the causes for this kind of fibroid problem?
Yes, because what it does is it decreases your natural flora from your body, and it declines the good bacteria. It also kills the good bacteria which is inside your body, and you become more prone for the infection when you're taking it for the long time. So that's why when you are getting the slightest infection, you will get it. So that's why
really very good information. Thank you for sharing that, Komalji, because antibiotics is like people just take antibiotics.
Yeah, and that's why I always prescribe probiotics with the antibiotics. Even I want to tell this to my listeners who are not aware of this. When your doctors are prescribing you antibiotics, please do ask them to prescribe you probiotics. And if they don't prescribe you probiotics with that, you can go over the counter and take that. Please, it is really necessary to take probiotics with your antibiotics. We cannot save the immunity level, but at least we can save the good bacteria inside your body with the probiotics.
Okay. Well, again, listeners, this is some very important and very informative topic we have today. So, Komalji, now, what kind of a treatment is there in conventional medicine for fibroids?
Okay. So, fibroids, I was already telling you that, when we go in the conventional medicine, so first their target is to stop the bleeding, right? To stop the bleeding, what they have is they can give you artificial hormones, right? They will give you estrogen and progesterone so that they can stop the feeding of the fibroid. Right, your body will not get that hormone, so that your fibroid will stop and the bleeding will stop, and women will say, okay, I'm fine. Okay, but then it is only a temporary relief, because it tends to disturb your normal hormonal balance of your body. Okay, and then the women get other problems, like they will get thyroid problem, they will get the aging problem, they will get a lot of mood disturbances. So many of problems starts because of the disturbances of hormones, right?
So these are some common symptoms which one should be looking for, when we are going in for a treatment, and then we see all these symptoms are coming up, then we should start looking for some other, more holistic or more natural treatment.
Yeah, and then when the size is increased, then doctor will say, okay, you can get it removed, right? You can get the surgery done. You can completely remove it. But the thing is, we have to understand it is coming from the wall. You can remove it once, but what will you do about this multiplication of the cells inside? It's
So
gonna
you have
grow
to
back
stop that.
again. Yeah, the same thing I tell for the nasal polyp also, right? So if something is pedunculated from any wall, you can cut it down, but you cannot stop the multiplication of the cells. So what it gonna happen is it's the cells gonna multiply in so many directions. Before that, it was only in one direction. Right?
It's
So
like a root, then that means, the tree is
exactly.
coming.
Yeah. So we have to stop that root. We have to treat that root first, and then of course the pedunculated part, it's gonna get fall itself.
Yeah.
So you don't need to cut it down.
Right. And this is one of the basics for homeopathy, that, the homeopathy eliminates a problem from its root cause.
Yes.
It's not that, it's just taking it away from the surface level, it's just curing it from the root cause, so that, so this goes with most of the conditions when homeopathy is treating, so it takes it out from the root, right?
Yeah, right.
Okay, all right. So what is the treatment in homeopathy then, if we are talking about, what is the treatment in homeopathy for uterine fibroids?
Okay, so in homeopathy, we consider whole case, whole patient, and we have to take the whole symptomatology, whole diagnosis, whole laboratory results, and we have to look about all the hormones which are released in the body. If there are any other imbalance, we have to treat that too. Along with that, we have to read the psychology of the patient. Because according to that, our medicines differs, because sometimes few patients you can see they are having so much of heavy menses, lot of clots, lot of pain, but they are quite few people are happy, right? They will happily say, okay, I'm having this problem, okay, I'm used to this, that. So in this case, phosphorus medicine we have, it gives very good results, right? But yeah, on the contrary, if we have the patient very depressed, very cranky, very very cries oftenly, so in that case we give pulsatilla. So according to case it matters. So we have to see different type of symptomatology of the patients. So we have to see as a whole. I cannot tell over the counter medicine for this problem.
Right,
because
that's
it's
what I was
hormonal
about to ask you now. That means then it's not advisable to take over the counter
No,
medicine.
not at all,
Yeah.
not at all, because it is not a common cold cough. It is a problem which is related to the hormones. So if we give over the counter medicine, or even I can tell any patent medicine, but it's not gonna help the patient.
It varies from one person to the other, and again that's another principles for homeopathy, that they have to take the constitution of a person, and then
Yes.
Based on their symptoms, how the medicine is given. So that's why. So typically, if a patient is coming to the office, how much time for an appointment it takes for you to take the symptoms and take the symptomatic history down, and then is it like a
So you mean okay? So you mean how much time do we need to give patients?
Patients are they are always in a rush. I need an appointment, and then I have another appointment too. Usually, I have noticed with the office, especially on the weekends, we have so patients, they have to be ready for that. So typically, how much time it takes? We have only 30 seconds, Komalji. So
okay. So I want to tell this finally. So I want to tell okay, if you're coming at a first time, so first time we need to take your whole history. So at least we need half an hour. And after then, it just takes 5 or 10 minutes. That's it.
All right. Okay. Yeah. Thank you so much, Komalji, for coming in today
so much,
and sharing all this information with us. And listeners, again, this was California Homeopathic Clinic. We are located at 1121 East Santa Clara Street, and the number is 408-287-9300.
Thank you so much, dear listeners.
Download the all-new Daisy 1170 AM app. Visit the iPhone or Android app stores, or visit Daisy1170am.com to grab it now and hear us everywhere you go. Daisy 1170 AM, radio that listens to you.